We're here at Stratford Dermatherapy Clinic with Dr. Hugo Kitchen and Mr. James Kitchen, and they're going to tell us all about dermablading. Hugo, can you tell us the reason for dermablading?
Dermablading is a specialised device for treating and removing unwanted facial hair. Sometimes we call that peach fuzz. This can occur with people who have hormone imbalances or polycystic ovary disease, or it can just be the way you are. It can also get rid of the surface cells on your skin, a little bit like a dermabrasion, which can leave you with a much nicer glow and iridescence to your skin prior to perhaps any treatments that we might do.
And James, can you tell us the benefits of dermablading?
Dermablading is an ideal alternative to those patients who don't get on with microdermabrasion because they have sensitive skin. There's no downtime to this treatment. There may be a little bit of redness or slight swelling after the first treatment, but the results are that the skin appears revitalized and fresh, ready for your next treatment, which is possibly going to be in a month's time.
And is it right that you can have this treatment even if you're pregnant and breastfeeding?
Certainly, because there are no chemicals involved in this treatment, and therefore, as I said, the downtime for this treatment is relatively low.
And you've got a new elite dermablading treatment here, I believe.
The elite derma treatment is very special because once we've ideally taken off the dead skin and the vellus hair, this will open the gateway to the skin where we can do a special chemical peel, a mild chemical peel, which will involve using fruit acids such as glycolic and salicylic acid, which will not inflame the skin but will leave you with really quite revitalized skin.
And as from somebody that's had it, I know that it also makes your makeup go on beautifully. So here we are with our lovely patient about to have the elite dermablading treatment. James, to me, it doesn't look as though she's got much hair, but would you say that's not true?
Well, on closer examination, there is some fine down there, but more importantly, we do have various areas of pigmentation there, which I think would be better served with the elite peel to go with this.
Okay, so here she is before. We will be seeing her after in a little while. Dr. Hugo Kitchen is going to perform the treatment, and we'll show you what we actually remove.
Okay, you've got your skin all nice and clean, ready for me to do the dermablading. Any little questions that cross your mind before we start?
Yes, just if it does grow back again, does the texture grow back thicker with the hair growth coming through?
Different types of hair on the face and all over the body. When we take these hairs off, they come back exactly as they were before we started. So we're taking off this little vellus baby fluff, peach fuzz. It'll come back as peach fuzz. It takes about 6 to 8 to 10 weeks for it to all come back. Each time we do the treatment, the time between treatments will get longer. And also you'll probably have much less hair growth. It looks like a standard scalpel blade, but in fact the blade is square towards the actual tip rather than V-shaped like a normal surgical scalpel. So it's less traumatic, but it will abrade the surface. It's not just about getting rid of the hair, just to recap, it's also about taking off the surface cells of the skin to give us access to maybe putting on, as we will see shortly, a nice peel which will dive down into the skin and give it all that goodness. So it's a simple action. We can see if we just stretch the skin here, and you can see immediately that the baby fluff is coming off. What does that feel like?
Very comfortable.
Very comfortable. So we're not slicing.
Can you pick a little bit of that up on the dermablading thing or in your fingers? And there we are. Lisa didn't look as though she had any facial hair. And here's what we've taken from half of the face. Bearing in mind, Lisa didn't have any makeup and we thought she wasn't very hairy.
So you can see the hair here, and look at the makeup that's come out with some of the skin cells. So it's actually a deep cleanse as well, you know. It's These are dead cells and the vellus hair. You can see, you know, it's just baby fluff. Okay, so we've done one half of the face. We've taken off pretty much all the hair and a few little surface cells in preparation for your peel. Just have a little feel now of this side of your face, which I've done.
Oh my God, it's just like a baby's bottom.
You see? Look how much fluff there is there.
Just watching this, one slip of that blade is a little bit worrying. So would you say definitely you have to be a trained professional to do this?
It's not for the faint-hearted. There are some serious structures obviously in the face, and if you use the blade wrongly you can slice through the skin. So we are merely using the weight of the scalpel handle and the blade itself. I'm not pushing, I'm not dragging it across the skin. It's just literally sliding through the little hairs and gliding over the cells, and it all just comes off onto the blade. I'm not having to cut. So in conclusion, the answer to that is yes, of course, this requires training and a certain amount of skill. It's a very fast curve of learning. It's not difficult, but you certainly have to have been trained properly by a medical professional to be able to do this. And also, I would imagine, to get a license to practice doing this to satisfy your insurers, because you will need to be medically insured.
Your face just feels smaller.
It is. It'll look smaller too, because you haven't got that little 2mm
No,
sort of
fullness on it.
And I
Yeah.
think also the light reflects off your
Feels
skin
lovely.
rather than being absorbed
Please look.
by the hairs.
Oh my God.
Show us, Lisa.
Wow.
Mm-hmm. So Lisa has had her dermablading, and you could leave it at that, but with the elite dermablading treatment we then do a very mild skin peel. So James, do you want to tell us about it?
The skin peel it's called a milk peel, and it contains 10% by volume of glycolic and salicylic acid. And now that Hugo has taken a lot of the dead skin cells off the skin, it now opens the gateway for this peel to be used. There's no point in using a stronger peel than this, because what we want is just a mild exfoliation in the next few days.
So Lisa isn't going to be having like a snake shedding her skin after this?
No, there's no shedding, but there will be a little bit of flaking. And Lisa will now tell me what she feels as I'm applying it.
A lot of tingling, like a slight burning sensation.
Is it bearable, Lisa?
At the moment it's bearable.
So James, what are the common things that in somebody of Lisa's age group that we see most of in the skin that we try and alleviate?
There's open pores, blocked pores.
Yeah.
We've got white heads, black heads. There's predominantly sun damage. So what we can expect to happen is those sun damaged areas to start flaking off within the next few days.
So things like little sun freckles and
Absolutely.
photo aging.
And how long do you leave this on for?
Usually a minute to a minute and a half. So
As
what are we
Lisa
feeling now?
breathes a sigh of relief.
Are you stinging now?
I'm stinging, yeah, but it's still okay.
And on a
Still
score
bearable.
of 1 to 10, where 10 you can't bear anymore,
I'm on about 6 to 7. How do you look after the skin once it's been treated?
okay, so once you've started flaking, the most important thing to do is to protect your skin. So we provide you with an anti-inflammatory and a sun protection factor all in one. So it'll de-inflame the skin and also protect at the same time. But you need a minimum of filter factor 50 on your face following a treatment like this.
Okay.
Is there much downtime? Lisa's looking fairly pink at the moment.
And I'm going to take it off.
How long will that last for, do you think?
The pinkness,
Mm-hmm.
half a day.
Okay, so if somebody were coming in by tomorrow, they'd be able to go to work?
They probably would be able to go back to work tomorrow. Some of the products that we use to calm the skin down and protect it afterwards can be a little shiny. We would probably ask the patient to avoid wearing makeup for the first 24, 48 hours. Bearing in mind that we've taken the surface cells off, it's important that we don't reintroduce anything other than the treatment creams to prevent things like infection. So that's really important.
Right, and here's Lisa looking increasingly like a mummy. How's it feeling, Lisa?
Hi.
Cooling down?
It's slightly cooling down. It's still tingling.
We'll leave you for a second. Is there anywhere else you can use this on the body?
Yeah, usually when we find girls coming in with vellus facial hair, they tend to have really quite vellus hair on the forearms as well, so forearm treatment would be extremely useful as well.
Great. And Lisa, how are you feeling now?
Really comfortable. Face feels a little bit warm, but no stinging or soreness on the face at all.
Great, and as you can see, it's lovely and smooth. We will put some photographs online of Lisa afterwards when everything's calmed down.